Hello, good afternoon everybody. Myself Dr. Vikash Kumar Agarwal, cancer surgeon from Calcutta. Our product is Mapot. All of us have felt pain in our life, and whenever the pain comes, the first thing is Ma or the mother. Similarly, the pain of cancer, I think whole world is aware about it. And pain of cancer is more with the chemotherapies, which is given injections multiple times, and the pain, ulcers, extravasation, a lot of complications are there, which is more than the pain of cancer. To relieve this cancer pain from the patient, we have a patented device, Mapot, sutureless chemoport with the flexible flanges. They are the already imported ports which are available in the market in the range of 30 to 35,000, and which is very costly in the country like us, which have a diverse economy status. And cancer does not differentiate between a rich and poor. It can affect anybody. So to relieve the pain of chemotherapy in these patients, we have made a affordable, made in India and a patented sutureless chemoport. This device has multiple advantages because in these old available devices, you need to fix it with the small sutures and they can dislocate, they can migrate, the port can displace, and it is tedious process, painful to the patient. In our device, it is just like plug and just like a belt, you fasten it. So ease of placement, less painful, and ease of removal, less inflammation. The size is just like a size of a tablet, so it's very less discomforting to the patient. And the advantage of this chemoports, these can be used to draw the blood directly from the heart if the patient requires testing, which a cancer patient regularly requires. You can infuse medicines, and this can be punctured 2,000 times, and once you puncture it with a needle, you can keep the needle for 3 to 5 days. So the patient can complete the treatment for the whole lifetime. That is the advantage of Mapot. For our clinical application, you can see we have migrated from these stages and we have reached to this final stage where our product is ready. Because it's an implantable device, it's a device which will be there in the body for more than 6 months. It becomes a type C medical device coming in contact with the blood. So we are now TRL 6 plus, everything molds and others are ready, the biocompatibility testing and a CDCO certification followed by ready to use. So the conventional therapies are given in the veins. Okay, and the moment the chemotherapy goes in the vein, I'll show you a picture. The simplest thing which can happen is the vein get thrombosed. It's a painful hand, and now you can't give any more chemotherapy in this hand. So, and if the chemotherapy comes out of it, you can imagine what will happen. It will be an ulcer which will never heal. And with this kind of device, it is, you can see the video, this is implanted inside. You can even go for the swimming and everything, nothing is outside. There is a different version between the vein lines and this central port are called a peripherally inserted central catheters, but those things lies outside. We in India have a risk of infection. Taking care of those are very difficult. Here you don't require any care. Once a month you go to your doctor, get your therapy or get it flushed. That's it. So, like a chronic kidney disease, we are a world capital of diabetes, which is leading to a huge number of chronic kidney cases, which requires a regular dialysis. So these patients, they have shunts in one hand, so you can't use that hand. One hand where we require some therapy. So in those who require long-term treatment, long-term nutrition, so GI disorder, where you require long-term IV total parenteral nutrition, the port can be used. So there are multiple uses. Apart from this, you can even use as in the different places where the necks are doing surgery In that, if you require this, you can put it in the other large vein called a femoral vein and others. So there are multiple uses apart from the chemo also. So for the certifications and this, the CDSCO certification, biocompatibility itself costs 20 lakhs. CDSCO will be in the range of 10 to 15 lakhs. And the CE and the FDA certification, because now we are India, which is looking not only for make in India, but to export these to other countries, not only the ASEAN, even in the other countries. So CE and FDA would require another 25 to 30 lakhs. Apart from the industry manufacturing unit, so we are looking in the range of 5 to 10 CR so as to complete all legs. And the business opportunity is huge because we have seen a pandemic of COVID. Cancer is a pandemic. As per the data available in Google and everywhere, 1 in 10 men in India has a risk of cancer, 1 in 8 female. Already 15 lakh new cancer patients every year, and 70 to 80% requires chemotherapy. So the huge opportunity of the investor to get a hike in his investment from seed to series A or B, everybody will be benefited. The investment as a partnership in the company and 5 to 10 CR so that we can complete the leg. Half completion, even initial of 1 CR, and once we complete the leg, then they invest the further. That's okay. So it should be a. It is amazing. We are already a big Bharat grantee. So that was a huge support in the development phase. And after attending this, brushing a shoulder with those who's in the industry, those who have developed from innovation to a company, the words of wisdom and are huge, which has helped us in overcoming the hurdles, reducing the cost of biocompatibility, meeting the people who are into biocompatibility and testing and others. So that will be a great leap for us to move forward to market.